Hello everybody, my name is Roisin Trainor. I'm the General Manager of Derma UK, and I'd very much like to thank you for the opportunity to meet with you today and to share some information on some of the products that Derma UK host in its general portfolio. As per the company name, Derma UK is largely focused on dermatology. That is where the mainstay of our experience comes from. But we do have products that sit within the obstetrics and gynecological areas as well. So I'd very much like to introduce you to a couple of those today throughout the course of my presentation. One of those products in particular is something that touches on the subject of pruritus in pregnancy and the use of what is an age-old ingredient presented in a modern formulation, and that can be used to assist in alleviating the symptom of itch in pregnancy. So I'd like to start off with that. So I'll just move my slide on. To introduce you to the ingredient that I alluded to earlier, that of menthol. Now, menthol, as you will appreciate, has been around for an extremely long period of time. We have eons of experience with menthol as an ingredient in items that we eat, in items that we drink, in items that we inhale, in items that we also apply to our skin. In fact, it's menthol and its use in dermatology has been around for a long time, and dermatologists are quite familiar with using menthol as part of a treatment regime for pruritus. Largely for pruritus, but also to provide some antiseptic coverage, analgesic coverage, but more so to provide cooling formulations that can assist and alleviate the symptom of itch. So it is quite common to use menthol topically, and it can be used at varying concentrations on the skin. We know largely 1 through to 3%, but 5% is now available for use as well in the UK. And with that variation in percentage of strength, that gives you some choice to introduce variations of strength to the patient to find out which one suits them best. So the ingredient itself is that of menthol, and as I say, something that we've had eons of experience with. Now, when we discuss the symptom of itch, it's very easy for us to say, don't scratch, try not to scratch, try to think about something else. But when you're experiencing that itch, it's very difficult not to scratch, to give you that alleviation of the symptom. And itch in pregnancy can just come hand in hand with pregnancy in general. And obviously we are all aware of the itch that's associated with obstetric cholestasis. Now, with dermatology background and looking back to what is an aim in dermatology, is to divert people away from scratching that itch so that they don't cause more damage to the surface of the skin. They don't interrupt the integrity of the skin and therefore cause additional problems such as the introduction of superficial skin infection, etc., and very raw, irritated skin that then is part of the itch scratch cycle and feeds itself, and the itch is never really alleviated because we're scratching and we're causing more itch, etc. So the need to break the itch scratch cycle is very prominent, especially when the itch is very intense. There are guidelines for the management of pruritus and the suggested use of menthol to alleviate the itch and being effective at strengths of 1 to 5%. So what Derma UK have done is they've taken this age-old ingredient of menthol and they have put it into a very stable formulation, which we now have experience of over a number of years. And that formulation itself is now called Menthoderm. And the Menthoderm can help to assist in making pregnancy and any itch associated with pregnancy. We can alleviate that and try and make pregnancy as comfortable as it can possibly be. So moving on a slide. The range of Menthoderm that Derma UK are responsible for as part of its portfolio is, as you know, a menthol and aqueous cream available in varying strengths. It comes in 0.5, 1, 2 and now 5% strengths of menthol within this SLS-free, sodium lauryl sulfate-free aqueous cream base. And the whole intent behind Menthoderm is that it is there to alleviate, to soothe heated, dry and itchy skin, and to divert the attention of the patient away from the need to scratch that itch. So the Menthoderm range is something that I'd just like to delve into a little bit further with you, but that gives you a flavour of its availability, the varying strengths and also the varying pack sizes that you can see there, and the need for varying pack sizes as well, which we'll just come on to. So Menthoderm I've mentioned as being sodium lauryl sulfate free, which is something that most dermatologists will look for within an aqueous cream base. So it's important for us to be sodium lauryl sulfate free so that we meet the market conditions. Menthoderm also contains not only menthol, but it also contains another 2 preservatives to provide double protection, so that, for example, no infection is introduced into the packaging itself, and that gives the patient uncompromised hygiene and assists in protecting what is already dry and irritated skin. As I've already said, it is available in strengths of 0.5%, 1, 2 and 5%. The most popular strengths are those of the 1% to 2% range. The 2% gives you that slightly enhanced feel, whereas the 5% is really where an itch can be very intense and all-consuming. So ideally, the best thing to do is to test out with testers, which Derma UK can provide, what strength suits your patients best. We'll come on to talk about testers shortly. But in terms of packaging, we have a variation of packaging which moves from 100-gram tubes, which are ideal just to put in the handbag and when you're out and about for daily use. We also have 500-gram airless pump dispensers, and this is an industry standard pump pack. It gives 98% complete evacuation of the pump. And if there's any cross-contamination risk at all, this airless pump dispenser certainly eliminates that. 500-gram pots are also available if there's any issues with dexterity, or if anybody has a real need to dip in and get it on quite quickly. You've also got that option whether they prefer a pump or a pot dispenser. So we have some flexibility with the packaging there that would potentially suit all needs. In addition to alleviating itch in pregnancy, and more specifically that of a generalised itch in pregnancy, but also obstetric cholestasis, Menthoderm can also be used to alleviate menopausal hot flushes, just by liberally applying the product itself to the nape of the neck to provide a sort of an instant cool down. It can be used not as an after sun, it's definitely not an after sun, but to help cool and soothe sun-scorched skin. You know, when you've been out and perhaps burned a little bit too much, you just need to cool down. And also in sport, when a cool down is needed after you've worked up a sweat. So it has a number of options of use, but largely within pregnancy, we know that itch can occur as a symptom of pregnancy, but also with obstetric cholestasis and intense itch can also occur, and Menthoderm can definitely assist in alleviating and soothing that itch for patients. It also receives an NHS recommendation for alleviating the symptom of itch as menthol in aqueous cream. That does come as part of the NHS site on a direct recommendation for the use of menthol topically in alleviating obstetric cholestasis. In terms of pricing, Menthoderm has a lower cost than the drug tariff, menthol and aqueous cream that is also available. It's reimbursable in pharmacy, and as I discussed, samples can be requested online at dermauk.co.uk. They are readily available to send out, and that's the best way to determine exactly which strength suits your patient and their needs. And I would always recommend using samples to give your patient that experience, allow them to interpret what Menthoderm is going to feel like on their skin, and then decide which strength suits their needs and will alleviate their itch. So I think Menthoderm as a package is a very nice option for alleviating that itch associated with pregnancy. The second product that I just wanted to introduce to you as a reminder is that of Hibitine. Now, I'm sure that largely you are aware of Hibitine obstetric cream and its position on the trolley within the labour suite. We'd just like to give you this reminder that Hibitine obstetric cream is the chlorhexidine-based lubricant with a formulation that's been preventing risk of infection for over 60 years. We have a lot of experience with Hibitine used in the labour suite setting, and the chlorhexidine itself is a highly effective antiseptic and antimicrobial, effective against a very wide range of gram-negative and gram-positive bacteria, yeast, dermatophyte, etc. But the intention of its use is that cleansing of the birth canal, that interruption of any introduction of infection during the labour process, during PV examination process, etc. So Hibitine obstetric cream, available in a 250 ml bottle, as you would know, but also now available in smaller bottles of 50 ml size in a pack of 10. The introduction of the 50 ml bottle occurred after a UK-wide survey that was conducted for single patient use and presenting Hibitine in that option of packaging. And you know, we know that in various settings, Hibitine in its 50 ml bottle might be suitable whereby a department is looking for a single patient disposable bottle, or indeed in the community setting where you might want to use Hibitine in a smaller package size. So that is readily available as the 250 ml bottle is via all wholesalers. So to the conclusion of my presentation, please visit us on our website, www.dermauk.co.uk, for further information on both Hibitine and Menthoderm. Hibitine, what's available is a free practice and information guide, and with Menthoderm, samples are available on request for additional testing for your patients to experience the sensation of using Menthoderm to alleviate that itch. So that concludes my presentation for today, and should you have any further questions, please don't hesitate to contact Derma UK, and thank you very much for your time. Thank you.